Hi, and welcome viewers of Nursing Academy 101. In this video, we'll talk about nursing medical surgical immune system multiple choice questions and answer part 1. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all news. Question number 1. The function of monocytes in immunity is related to their ability to a. Stimulate the production of T and B lymphocytes. B. Produce antibodies on exposure to foreign substances. C. Bind antigens and stimulate natural killer cell activation. D. Capture antigens by phagocytosis and present them to lymphocytes. The answer is D. Capture antigens by phagocytosis and present them to lymphocytes. Question number 2. One function of cell-mediated immunity is a. Formation of antibodies. B. Activation of the complement system. C. Surveillance for malignant cell changes. D. Opsonization of antigens to allow phagocytosis by neutrophils. The answer is C. Surveillance for malignant cell changes. Question number 3. The reason newborns are protected for the first 6 months of life from bacterial infection is because of the maternal transmission of A. Immunoglobulin G, B. Immunoglobulin A, C. Immunoglobulin M, D. Immunoglobulin E. The answer is A. Immunoglobulin G. Question number 4. In a type 1 hypersensitivity reaction, the primary immunological disorder appears to be a. Binding of immunoglobulin G to an antigen on a cell surface. B. Deposit of antigen-antibody complexes in small vessels. C. Release of cytokines used to interact with specific antigens. D. Release of chemical mediators from immunoglobulin E-bound mast cells and basophils. The answer is D. Release of chemical mediators from immunoglobulin E-bound mast cells and basophils. Question number 5. The nurse is alerted to possible anaphylactic shock immediately after a patient has received intramuscular penicillin by the development of A. Edema and itching at the injection site. B. Sneezing and itching of the nose and eyes. C. A Wheal-and-flare reaction at the injection site. D. Chest tightness and production of thick sputum. The answer is A. Edema and itching at the injection site. Question number 6. The nurse advised a friend who asked him to administer his allergic shots that A. It's illegal for nurses to administer injections outside of a medical setting. B. He is qualified to do it if the friend has epinephrine in an injectable syringe provided with his extract. C. Avoiding the allergens is a more effective way of controlling allergies, and allergy shots are not usually effective. D. Immunotherapy should only be administered in a setting where emergency equipment and drugs are available. The answer is D. Immunotherapy should only be administered in a setting where emergency equipment and drugs are available. Question number 7. Association between HLA antigen and disease is most commonly found in what disease conditions? A. Malignancies. B. Infectious disease. C. Neurological disease. D. Autoimmune disorder. The answer is D. Autoimmune disorders. Question number 8. A patient is undergoing plasmapheresis for treatment of systemic lupus erythematosus. The nurse explained that plasmapheresis is used in her treatment to A. Remove T lymphocytes in her blood that are producing antinuclear antibodies. B. Remove normal particles in her blood that are being damaged by autoantibodies. C. Exchange her plasma that contains antinuclear antibodies with a substitute fluid. D. Replace viral damaged cellular components of her blood with replacement whole blood. The answer is C. Exchange her plasma that contains antinuclear antibodies with a substitute fluid. Question number 9. The most common cause of secondary immunodeficiency is A. Drugs, B. Stress, C. Malnutrition, D. Human immunodeficiency virus. The answer is A. Drugs. Question number 10. What accurately describes rejection following transplantation? A. Hyperacute rejection can be treated with OKT3. B. Acute rejection can be treated with sirolimus or tacrolimus. C. Chronic rejection can be treated with tacrolimus or cyclosporin. D. Hyperacute reaction can usually be avoided if cross-matching is done before the transplantation. The answer is D. Hyperacute reaction can usually be avoided if cross-matching is done before the transplantation. Question number 11. In a person having an acute rejection of a transplanted kidney, what would help the nurse understand the course of events? Select all that apply. A. A new transplant should be considered. B. Acute rejection can be treated with OKT3. C. Acute rejection usually leads to chronic rejection. D. Corticosteroids are the most successful drugs used to treat acute rejection. E. Acute rejection is common after a transplant and can be treated with drug therapy. The answer is B. Acute rejection can be treated with OKT3, and E. Acute rejection is common after a transplant and can be treated with drug therapy. Question number 12. Which statement made by the nurse is most appropriate in teaching patient interventions to minimize the effects of seasonal allergic rhinitis? A. You will need to get rid of your pets. B. You should sleep in an air-conditioned room. C. You would do best to stay indoors during the winter months. D. You will need to dust your house with a dry feather duster twice a week. The answer is B. You should sleep in an air-conditioned room. Question number 13. When caring for a patient with a known latex allergy, the nurse would monitor the patient closely for a cross-sensitivity to which foods? Select all that apply. A. Grapes, B. Oranges, C. Bananas, D. Potatoes, E. Tomatoes. The answer is A. Grapes, C. Bananas, D. Potatoes. Question number 14. 10 days after receiving a bone marrow transplant, a patient develops a skin rash on his palms and soles, jaundice and diarrhea. What is the most likely etiology of these clinical manifestations? A. The patient is experiencing a type 1 allergic reaction. B. An atopic reaction is causing the patient's symptoms. C. The patient is experiencing rejection of the bone marrow. D. Cells in the transplanted bone marrow are attacking the host tissue. The answer is D. Cells in the transplanted bone marrow are attacking the host tissue. Question number 15. A patient's low hemoglobin and hematocrit have necessitated a transfusion of packed red blood cells (RBCs). Shortly after the first unit of RBCs started to infuse, the patient developed signs and symptoms of transfusion reaction. Which type of hypersensitivity reaction has the patient experienced? A. Type 1, B. Type 2, C. Type 3, D. Type 4. The answer is B. Type 2. Question number 16. A patient has begun immunotherapy for the treatment of intractable environmental allergies. When administering the patient's immunotherapy, what is the nurse's priority action? A. Monitor the patient's fluid balance. B. Assess the patient's need for an analgesic. C. Monitor for signs and symptoms of an adverse reaction. D. Assess the patient for changes in level of consciousness. The answer is C. Monitor for signs and symptoms of an adverse reaction. Question number 17. A healthy 65 years old man who lives at home is at the clinic requesting a flu shot. When assessing the patient, what other vaccinations should the nurse ask the patient about receiving? Select all that apply. A. Shingles, B. Pneumonia, C. Meningococcal, D. Haemophilus influenza type B, E. Measles, mumps, and rubella. The answer is A. Shingles, B. Pneumonia. Question number 18. On initial assessment of an older patient, the nurse notes to look for certain types of diseases because which immunologic response increase with age. A. Autoimmune response, B. Cell-mediated immunity, C. Hypersensitivity response, D. Humoral immune response. The answer is A. Autoimmune response. Question number 19. A 21-year-old student had taken amoxicillin once as a child for an ear infection. She is given an injection of Penicillin V and developed a systemic anaphylaxis reaction. What manifestations would be seen first? A. Dyspnea, B. Dilated pupils, C. Itching and edema, D. Wheal-and-flare reaction. The answer is C. Itching and edema. Question number 20. The patient with an allergy to bee sting was just stung by a bee. After administering oxygen, removing the stinger, and administering epinephrine, the nurse noticed the patient is hypotensive. What should be the nurse's first action? A. Administer IV diphenylhydramine, Benadryl. B. Administer nitroprusside as soon as possible. C. Anticipate tracheostomy with laryngeal edema. D. Place the patient recumbent and elevate the legs. The answer is D. Place the patient recumbent and elevate the legs. Question number 21. The patient with an autoimmune disease will be treated with plasmapheresis. What should the nurse teach the patient about this treatment? A. It will gather platelets for use later when needed. B. It will cause anemia because it removes whole blood and RBCs are damaged. C. It will remove the immunoglobulin G, autoantibodies, and antigen complexes from the plasma. D. It will remove the peripheral stem cells in order to cure the autoimmune disease. The answer is C. It will remove the immunoglobulin G, autoantibodies, and antigen complexes from the plasma. Question number 22. The patient with diabetes mellitus has been ill for some time with a severe lung infection needing corticosteroids and antibiotics. The patient doesn't feel like eating. The nurse understands that this patient is likely to develop A. Major histoincompatibility. B. Primary immunodeficiency. C. Secondary immunodeficiency. D. Acute hypersensitivity reaction. The answer is C. Secondary immunodeficiency. Question number 23. Which statement by the patient who has had an organ transplant would indicate that the patient understands the teaching about the immunosuppressive medications? A. My drug dosage will be lower because the medications enhance each other. B. Taking more than one medication will put me at risk for developing allergy. C. I will be more prone to malignancies because I will be taking more than one drug. D. The lower doses of my medications can prevent rejection and minimize the side effects. The answer is D. The lower doses of my medications can prevent rejection and minimize the side effects. Question number 24. Emerging infections can be affect healthcare by. Select all that apply. A. Revealing antibiotics resistance. B. Generating scientific discoveries. C. Creating a strain on limited resources. D. Challenging established medical traditions. E. Limiting travel options for nursing personnel. The answer is A. Revealing antibiotic resistance. B. Generating scientific discoveries. C. Creating a strain on limited resources. D. Challenging established medical traditions. Question number 25. Which antibiotic-resistant organism can't be killed by normal hand soap? A. Vancomycin-resistant enterococci. B. Methicillin-resistant Staphylococcus aureus. C. Penicillin-resistant Streptococcus pneumonia. D. B-lactamase producing Klebsiella pneumonia. The answer is A. Vancomycin-resistant enterococci.